let's talk about the functional impairments, occupational impairments, uh, the changes to the way they're doing that. And then also they're doing away with the 0% rating, which is a bullshit thing to even have on there anyway. Right? It's like doesn't even need to be mentioned if you don't have a condition. You don't need a zero, but you have a different view on that too. Let's start with that. So what are the changes to the actual ratings? And I'll give it
Well,
to you.
uh, mental health is going to be rated a lot more similar to how TBI is currently rated, which makes sense because 99% of TBI and mental health are intertwined anyways. So it makes sense that the rating criteria is similar. There's definitely distinct differences, but it is a similar because you're looking at 1 through 4 kind of level, or actually it's 0 through 4, 0 being none, 1 being mild, moderate, severe.
Mild, moderate. I have it on screen. So we have
Yeah,
none, mild, moderate, severe, and then total.
right. But there's 6 domains. So each domain is dealing with a different area of functional impairment. So where the current functional impairment with a rating schedule. I'll be curious to see how the new DBQ is going to look because you've got cognition is one domain, interpersonal interactions and relationships is another domain, and each of these domains are defined, and we can get into the definitions of that if we
Yeah, I'm
want to.
trying to find it, but yeah, keep
Um,
going.
the next one is task completion and life activities, and then we have navigating environments, and then the final one
Yeah,
is
well,
self.
where? Let me. Where is this?
This is
Uh, okay, task completion in life. Okay,
yeah,
okay. Let me get this
three.
straight. All right, so
Okay.
all right, so cognition is the first one. Is that what you said?
Yes.
All right,
And it,
so
and
that's
it basically
this
explains right
one
there.
right
So the
here.
assess would assess a veteran's mental processing involved in gaining knowledge and comprehension. These processes include, but are not limited to, memory, concentration, attention, goal setting, speed of processing information, planning, organizing, prioritizing, problem solving, judgment, decision making, or flexibility in adapting when appropriate. Kind of sounds like those checkboxes on the current DBQ, don't you think?
Yep, yep, totally.
The next one, interpersonal interactions, relationships, would assess a veteran's ability to effectively interact with other people in both social and occupational settings and participate in society. This domain includes both informal, social, and associational, and formal, co-workers, supervisors, and those sort of relationships.
And then
Uh,
on this, the social impairment here is different, and I think it's one of the harder concepts for veterans with mental health conditions that want to file claims, because we're kind of used to this, I don't know, Social Security model where it's all based on, and or like workers' comp and those kinds of things where everything is based on your ability to work and what you can do at work. And with
that's
VA ratings, they also consider your social life. So it's just weird, kind of upfront talking about how you don't have a relationship with your daughter or your son or somebody in your family just isn't working or is estranged or something like that, and just being socially awkward. All that stuff uh, can and will come into play here. So that's kind of what you're talking about, right?
Yeah. All right, so the
Okay.
next one is going to be task completion and life activities, and that would assess a veteran's ability to manage task-related demands. This domain includes, but is not limited to, the following types of activities: vocational, holding a job; educational, going to school; domestic chores, doing shit around the house; um, social, and caregiving, being able to take care of yourself, take care of others. So that's pretty self-explanatory. Navigating environments is the next one. Would assess a veteran's physical and mental ability to go from place to place. This domain includes, but it's not limited to, the following: leaving the home, being in confined or crowded spaces, independently moving in surroundings, navigating new environments, driving, using public transportation. So how are you, inside and outside of the home? How are you in restaurants? How are you, define the environment? That kind of deals with how you are in socially and those sort of things. And then, self-care is the last one. And that's the ability of to taking care of yourself, which would include but not limit to hygiene, dressing appropriately, nourishment, and nourishment can, eating or forgetting to eat, not eating, not taking care of yourself. I mean, it all falls under self-care.
So in this one, I have a little note on it. I think it's because I hear it a lot and people ask me about it a lot. And then I just kind of apply this to myself. So, like, I take care of myself, not very well, but I can care for myself. So I'm not going to go into a C&P exam more disheveled or stinky because I'm like, I take too many showers every day and I have decent looking clothes and all that kind of stuff. So I don't want to come up because it's lying in my mind. Showing up, how just show up however you are. If you wear a suit to bed and, around the house, or instead of wearing boxers or whatever, then show up in a suit. But if you don't do that, don't show up in your boxers probably, but don't show up in a suit. This one is hard. This one's easy to talk yourself into, I think. I don't know. What do you think?
Yeah, I mean, generally speaking, I mean, you dress appropriately so you don't get arrested, but I mean, you don't have to overdo it. I mean, you're there to present yourself on how you are on a regular basis. You're not there. I mean, you're not if you're dressing up in a suit, you're not giving your true representation of yourself. So you're not being
unless you wear a suit all the time, which is
right.
stupid.
I'm saying, but if that's not your normal attire, then it makes no sense. You want to present yourself as you are, so a proper evaluation can be given.
And these things, and walking over this line, it's not a gray area line. This is black and white. This is lying stuff, malingering stuff, Sims test kind of stuff. So if you go in there and you're talking about your problems, you're in an exam and you got to talk about all these problems. None of these things are fun or cool to talk about. They're embarrassing, and you should be crying because it's so pathetic. That's what happened to me, or that's where you need to get to. Unembarrassed about it because you need to talk about it. So you don't need to add or embellish. There's if you deserve a 70% rating, which I believe most veterans do deserve, then go through all this stuff, answer the questions that he's asking, and you don't need to add in stuff like for self-care, for example, if that makes sense. And then another thing about this is, let's see. So it says, let me get over the screenshot. So this is just kind of VA bullshit stuff. So we just went through the self-care. So this domain would include, but would not be limited to, and they give you a couple examples: hygiene, dressing appropriately, or nourishment. So one of the things the VA does across the board is they don't spell out exactly what you need, which would be nice. Like if you have this, this, and this. So basically, this domain would include, but would not be limited to, means it could be anything. That's just right.
Subjectivity is the name of the game with the VA. There is so much subjectivity. Yeah. And I think that's done intentionally.
Yeah, I think so too. When you're reading it, it does look weird. It's weird like that by design. It's about our money, and they want to keep our money. So there's lots of gamesmanship going on here. But kind of to your point, in the MST, with the MST claim, for example, that's where markers would show up. They don't show up in non-combat, like automobile accidents or anything that does some MST.
You can't use them. The markers can show up anywhere. I mean. You can't use them as far as the evaluation is concerned. As far as, you can't use a marker to prove or disprove something if it's not MST related.
And combat veterans, we just have that label slapped on us. So if Uncle Bill is like, wow, you should go file a, first of all, don't listen to Uncle Bill. He has his rating and his disability, and they're nothing like yours. And one example is if you're a combat veteran and he's not, or vice versa, that worked in my case for the stressor. I mean, not for the stressor as the nexus, but it might not work in your case. So understanding how the VA rates stuff is crucial, because if you have markers and it's a MST claim, it's usable. If it's not, the markers aren't usable. So it's good to know what's usable, what they're going to consider, and what they're not going to consider, because you want to put forward the evidence that's going to prove your claim using stuff that we're going to consider. They being this guy, what he used to do. Right? Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form, boom, you're done.